Welcome, everyone. I know we've got at least 40 people on Zoom, and people are trickling in here in person. We're super excited to have Dr. Timken here today for screening of 1001 Cuts. Many of the people in our department saw this film last year, and we decided to bring it to the larger community here. So I'll give a brief intro for Dr. Timken. So Sarah Timken is a gynecologic oncologist and first-time filmmaker. She spent over 2 decades providing surgical and medical care for women with cancer. She's widely published in the medical literature and has contributed throughout her career to conversations about equity in healthcare, including gender equity with the physician workforce. She was inspired to make this film, informed by her lived experience after leaving full-time clinical practice in 2020. She subsequently served as the Associate Director for Clinical Research in the NIH until 2025, and now works for the American Cancer Society, supporting early detection efforts. The format today, we will watch the film, which will be less than 30 minutes, and then we'll have a Q&A discussion, which Dr. Timken will kick off. All right, so.
The question I get most frequently is around why I decided to make this film. And so I just wanted to say a few words about this because, I think when I left full-time clinical practice, I had to do a lot of introspection, and I thought a lot about my career. And I thought about how in medical school, when I said, I want to be a surgeon, people generally said, oh, that's great, adorable, you can be an OBGYN. And I looked around and I saw people with knives taking organs out of people's bodies. And I thought, this looks like surgery to me. And ultimately, I became a gynecologic oncologist because I still wanted to be a surgeon. And I wanted to spend my days in the operating room. And I have to say, I always thought I would die at the age of 85 in the operating room because it was like my happiest place. And when I decided to become a gynec, I got a lot more gendered responses that were like, this is, such a hard field. And at the time it was almost entirely men. And people sort of questioned my decision about this. Like, it's so depressing. You really want to take care of people with cancer. And what's wrong with you? Like, why don't you like babies? And one thing I didn't really recognize is that I was born in 1972. And so that was the year that the Title IX legislation passed. And so meeting Annie Blaschke, who was the historian in the film, was like this real aha moment to me. Like, I was one of these daughters of Title IX. And when you look at what happened to medicine, because we don't think about medicine really with that legislation, between 1972, when the quotas were lifted on medicine, on women in entering medical schools, and 1980, which is just 8 years, the number of medical students in the United States who were women went from under 10%, where there was a cap, to 30%. So almost a third of medical students were women. And so since 2003, and I think most people are familiar with this data, about half of medical students have been women. And yet we still face these challenges. This is the data from the national academies that we show in the film, that women who are medical students almost half of them experience sexual harassment or gender discrimination before even finishing medical school. And this is about twice as high as the rates in other STEM fields. Women also still continue to be paid less. And this is, I think, in our society, a reflection of the worth that we place on women. Across racial and ethnic groups, women who are physicians still make about 70 cents on a dollar, regardless of their ethnicity or race, compared to their male colleagues. And the thing that I felt like the most in my career, I think, was like these perceptions of women. Despite women being everywhere, we still perceive these things that are really in conflict with us being physicians and taking good care of our patients. So this is from the comedian. I don't know, maybe people are not old enough to know who she is, but in the first Trump administration, she did these like brilliant caricatures of him. But she also wrote a book called How to Be Successful in the Workplace Without Hurting Men's Feelings, where she made these comparisons for men and women kind of doing the same thing, but being labeled in different ways. And I always felt this very deeply in my career. I think because I was raised in a male-dominated field, by men who took the time to train me. But then when it came to me performing the same work as they did, the rules were very different for me. And then just, this is across medicine, but women do a different job than men in medicine. They have more EMR in basket messages. They're less likely to get, despite better patient outcomes in many respects. They still are less likely to get rewards, and awards, and they're more likely to experience what we call microaggressions or burnout. And women do burn out more frequently than men in medicine and are about 25% more likely. This is just academic medicine, but across geographic regions, experience, specialties, women are about 25% more likely to leave academic medicine compared to men. And so what we're here today to talk about, and this is like what's the most fun about the film, is to talk about some of the solutions.
Thank you, Sarah. So we'll invite our illustrious panel down. We've got Dr. Van Kijken, assistant professor in FPMRS. We've got Dr. Loberis coming from us from surgery, and who took care of me during my intern year. So really happy to have her here today. Dr. Varma, who is our professor and chief of colorectal surgery, and Stoller, the leader of our endourology division. Thanks everyone for being here today. And so I also, we had one of the fellows from transplant who I wanted to bring down, but she just finished a case, has been up for 24 hours. So, but that first question was, what resonated with you in the film? And so I also invite everyone to think about, in one or two words, like what resonated with them. For me, I think two things kind of popped up. One is hope. So my mother is the youngest of five women, so very matriarchal family, and it's always been, it's always been women as leaders growing up for me. So I'm always very happy and excited to see this progress that we have. I think the other thing that really resonated was one of the surgeons was mentioning that, when they walk into the room and people see that they're a woman, or they're asking, they're like asking if they're the surgeon, and I experienced that as well. I'm consenting my patients, and when is the surgeon coming in? And you can definitely, like, that takes your energy away, and I think that's the whole idea of this 1,000 cuts. Like that can really deplete your energy if you focus on that. I think the thing that I try to look at it as is, this is a stereotype, and by being there, I'm changing that. So that would be my first little introductory thought. Oh, no slides. I'm just gonna need to pull up my questions there. All right, so next we'll have Dr. Van Kijken. Okay, so Michelle, the film opens with a riddle that exposes assumptions about who looks like a surgeon. What assumptions still exist about who belongs in a surgical specialty?
Yeah, so it's funny. I feel like I had heard that joke or that riddle at one point, like when I was younger, and I remember like also being stumped by it. And it's funny because even now, I'll find times in my own clinic where I'm seeing patients and I'm referencing another doctor that patient is seeing, and I'll refer to that doctor as a he, and the patient will correct me and be like, oh, she, and sometimes we'll have a good laugh about it together, like, oh, of course, like, why would I naturally assume that this person that you're seeing is a man? But I think a lot of these assumptions, are really kind of deep rooted. And I think it's, I think the film really focuses on medicine, but a lot of it really starts like from even our experiences, growing up as women. And kind of, I like this concept, like the children of Title IX, where, reflecting on my own experience in my own family, my own structure growing up was, mostly you see men in positions of leadership. Your dad is usually the one that works and makes the money. Your mom is the one that stays home and takes care of you. And my mom, who I love and adore and have a really great relationship, would sometimes even make these comments like, oh, your dad is the smart one. Your dad is the one that you should be doing your homework with. And I think that was really unfair to her. But I think some of that stemmed from even her own experiences of growing up being told when she decided to go to college, why do you need to go to college? You're a woman, you're going to get married. And so I think a lot of these biases that we experience in the workplace are really, really deep rooted. And I think that that's where, women, we get that kind of feeling from other women because women have only ever seen, men in those positions of leadership. And so I think challenging those assumptions can be difficult because again, they're like so deep rooted in our culture and our upbringing and who we've seen in these positions of leadership. And I think that idea of, representation again really matters, being the person that shows up. And so I think we're making slow progress by having, women and, underrepresented people in these spaces, but there's a lot of room to grow. And I'll add, like, the one thing that also gives me hope is, so I have a son, Lincoln, and a couple of years ago, he made a comment to me. He'd really his pediatrician was a woman. There's me. He knows Lindsay and a few other colleagues. And he was like thinking very pensively one day, and he's like, boys can be doctors too if they want to. So I thought it was like really great that he's like starting, like his perception. And I think even in the next generation will it's slowly going to change as they see other people occupying these spaces.
Great comment. All right. Our next question for Dr. Labares. And I'll also say if the audience has any comments or questions, there's a mic floating around, so feel free to jump in. Are there subtle signals that either invite or discourage women into our field? How might these be disadvantageous to our specialty and our patients?
Is this on? Okay. I had to call on friends thinking about this question. And at first, I don't know where Sarah. Oh, Sarah, hello. At first I was like, oh, this question's so dumb. It's so obvious. But then as we talked about it, I realized like it's actually really subtle because there's kind of the second part to it. Like, are there subtle messages? And then how does this affect our patients? And the way I was reading it, subtle messages that encourage us or discourage us. And so that's what we really talked about, was the encouraging us part. Because the film, I think, showed us really eloquently the discouragements. And any woman in the room, I'm sure, knows those, and any man in the room just saw them. That, we're too nice, or we won't be able to have kids, we'll get a divorce, we'll turn into a mean person, etc. I certainly worried about those things. But talking about the encouragements is sometimes I have heard myself, or I hear other women colleagues saying, oh my God, yeah, you can have it all. Like, come on in. Yeah, you can be married, have kids, have a good relationship, stay fit, be a good doctor, be a good surgeon, be the top of your game. And we had some passionate discussions. My friends and I, the two I'm thinking of in particular, have children. I'm child-free by choice. But when people learn I don't have children, they're like, oh, I just think like, really? Like, how many men choose not to have children? And no one like cries over it, no one buys them like a I wish you well card, And so we had this reflection about like, can you have it all? And I sort of landed on the side of, I'm not really sure you can. And my friends with kids, one of them is part of a mom's surgeon Facebook group. And she was saying she's watching so many of the 45, 50-year-old women surgeons drop out. And she's saying like, maybe this is proof. And that was talked about in the movie, that you can't have it all. And we don't really talk about that. Whereas my other friend who has two sons, just like the other woman, she said, well, I think you can, but you can't have it all at once. That you need to sort of stage what it is you expect to be able to do besides being a surgeon, because it does require a lot, not just during training, but always. The other thing is, I think maybe we don't prepare young medical students or young women surgeons enough about like what it is still like out there. Like, I have a lot of hope, but man, some of the sexual harassment I experienced was just like what I was hearing about up there. And that Grey's Anatomy scene almost made me cry. Yeah, sorry. But I made decisions about my career based on thinking, wow, if that guy feels like he can treat me that way as a resident, what's going to happen when I'm his junior partner? It's real. So I think we have to prepare people for that.
You're gonna make me cry now. The next question that we had for Dr. Varma, and then I think this segues nicely into that question, to kind of prevent these, or to get us closer to having it all. What is one change that our surgical departments could realistically implement in the next year to improve belonging and equity?
I think that I just wanted to echo just about the riddle because my children and I heard that riddle when they were, I want to say 6 and 8 or 7 and 9 or something. And someone else, another friend who's also a physician, was telling us the riddle. And I remember hearing it. And with the riddle, you're always like kind of overthinking it because you're like trying to get it. And I'm like, And my children immediately were like, the mom is the surgeon. Like it didn't even take them 1 second. And I was struggling. So I just want to say that gives me hope that this next generation is like, it's obvious. And I just wanted to address having it all. I agree. I think you can have it all, but just you can't be a great parent or a great spouse or a great surgeon all at the same time. And there's different times where you're going to prioritize one versus the other. But at the same time, those times when you feel like you're not a great parent, you're role modeling the ability to be a surgeon. And that is also very powerful. So I just want to say that to everyone. But as far as like what departments can do, I think there's just a lot of studies on just looking at like creating diversity in departments. And, I like to say diversity is like inviting everyone to the party, but belonging and equity is really about like, is everyone on the dance floor? Is everyone having a good time? Did everyone get what they needed to have a good time? That's the key, right? It's like we are constantly saying we have everyone at the table kind of thing, but it's just not true, right? So I think as far as like at a departmental level, the key elements of that are mentorship and sponsorship. And they're both equally important. And I think we spend a lot of time, probably everyone here has a mentor or, but it's like, are you?
I was raised by wolves.
It's like, does everyone actually have a real mentor who like looks in on them and checks on them and sees how they're doing? Or how many departments rely on the mentee to pick a mentor? It's like we put a lot of emphasis on the mentee to do the hard work, and the mentors should be the ones doing the hard work. And, obviously role models, it's important to see people who look like you ahead. But if that's not the case, other people can still be your mentor, And Van Jones said this great thing when I heard him speak one time. And he's like, your mentor doesn't always have to look like you, but they have to like you. And I think that is a really important and powerful aspect of it. And then equally important is the sponsorship. Is it can be your mentor, but it can also be other people, like at a departmental level. Are you thinking about everyone who's there? And are they getting the same opportunities? Or are you just thinking about the first person who comes to the top of your head who probably looks like you and you're offering that opportunity to them? So I would say those are two very important things.
Really, really good comment. Is there a question? Oh, sorry. All right.
Oh.
All right. And then Dr. Stoller, just wanted to get your perspective on what resonated with you with the film today.
Well, it's interesting for me being up on this crowd here, so I'll just say that first. But, I want to give a historical perspective even at UCSF. When I arrived here in 1981, there was not one woman who had ever finished any surgical discipline, period. None, whether it be general surgery and then urology. When we took our first woman as a resident, there are many faculty members who came to me and said, over my dead body, we're going to have a woman in our department. And, now I think we can be very proud that almost 50% of our, residents in urology are women. And when that first started, when the woman would go and see a patient, say, I don't want to see a woman. I said, well, then you could leave. You either see her, she's part of our team. And I would have just make a comment on being on this panel is that as a man, we have a responsibility to support the women in these situations, just not women, but other people who may be sort of looked upon as, well, you're not a surgeon or something like that. And so I honestly believe that we have a huge role in supporting and encouraging people to look at everyone as an equal. And we need to support the women and minorities and African Americans or Asians or whatever it may be. To give a perspective, one of my mentors at Berkeley was teaching the Biology 1 class there, which was the course that everybody had to take if you're going to be a pre-med. And when I was at Berkeley, it was like 90% men. And so I said, why don't you come and I was giving a lecture to the engineering department. Why don't you come earlier and come and sit in on the class? So I got there at 8 o'clock, one of those huge rooms at Berkeley. And it was like twice the size of this room. and it was like 90% women. There were no men in the room. And then about 15 or 20 minutes later, the men would walk in. They looked like they'd been playing a video game all night, or they were drunk. I don't know what they were doing. But in essence, the pipeline has completely changed. And then when you look at the applications on the medical school admissions committee here, the numbers are dramatically increasing. And so I'm hopeful. I'm hopeful that there'll be changes. My wife is a physician. I've heard all the issues that were explained in the movie. I've heard them, daily. And it was awful. And you have to support. So I think our role as the men in this group, in this room, we need to be supportive in any way we can. And if we send something, we need to speak up as much as you guys need to speak up. And so I think it's a equal opportunity for us to be able to make these changes.
Well said. Thank you. So audience, if you have any comments, please feel free. I'm just going to grab the Zoom chat, see what we have over there.
Yeah. And thank you for being here today and for the film. It was very enlightening. One of the things, my name is Marvin, I'm a fourth year medical student. One of the things that pointed out to me was the comment, and to echo Dr. Stoller's comments, was one of the speakers said that, and men look the other way as well, So in my life, not just medicine, there's been many opportunities where things have gone awry, where I look back and I could have said something, I could have intervened, but I didn't because it was uncomfortable for me. So I think to echo that as men, or anyone, to stand up for those who are marginalized is something very important to do. So not a question, but just a comment and a reiteration that I think this is like everyone's responsibility to do. And so it's very important for those who have power to actually use it for positive.
So there's an article from the New England Journal of Medicine from I think it's 2021, that's written by Reshma Jagsi and Michelle Mello, who's a lawyer, and they talk about this idea of upstanding. And the reason that that's one of my favorite articles on this topic is it's super practical. It has this whole list of things that people can do if they're in an uncomfortable situation. I've been now involved in this film for 5 years, but it was this month was the first time that somebody said to me, can you imagine in the Grey's Anatomy scene if someone had just stood up for Izzy, one of the other people in the locker room, because there were women in the locker room and men in the locker room, and if anyone had just said I don't think this is funny, she might not have had to take her clothes off, right? So I think that's a great point, and I think it's way harder than in the moment than saying that. I have moments that I wish I had said something different. I think that we have to do it collectively and make it safe for people to do that also.
Dr. Bowman.
Thanks for showing your film and making it. I just, as we were watching it, I saw so many of the women in the room just nodding vigorously to everything that was said. And obviously this is such a pervasive issue and we all know it, but it's kind of put on display here for sure. I think we're lucky at UCSF in some ways. We've had some really amazing women leading the way, the Nancy Ashers, the Linda Rileys, everybody here on the panel and a lot of the people in the room, but we're still, I think, lagging behind. And I did some locums in Mississippi after I finished residency, and they didn't even have a female locker room for the surgeons. It was all men. And even in my medical school at Dartmouth, there was no changing area for the women for anatomy lab. They had to change in a hallway with some lockers pushed up against a wall where people would walk through on their way to lecture. And then the men had a locker room with a code on it. So these are very institutionally entrenched problems, and they're changing slowly. I would love to hear from you guys on the panel what specifically men can do to serve as optimal allies for you and what you need from us so that we can elevate you or do whatever we can to break down these barriers or whatever is needed. Because I think that is incumbent on us men in the room more than anything.
Well, I just wanted to say one thing about that is that here at UCSF, I think we're extremely fortunate. We have so many women. It's the reason I came here to do my residency, because I interviewed with Dr. Asher and I saw people of different, race and ethnicity and gender that I had not seen in my own medical school. And I thought, this is where I need to be. Having said that, my first class of interns actually was 8 people and 4 of us were women. That had never happened before. So I've always felt like I've been a part of this wave of, being surrounded by women. But I think that gives us a false sense of security. It's like the whole thing I said about being invited to the party. It's like, we're here, but we were not invited for the secret drinks with the chair, like that, where all the boy residents were invited. It was all kinds of things were happening that were excluding us, right? So I think that as guys, like, being aware of being involved in things where your fellow resident or fellow faculty member is not, is a way to help. I think it's, it also comes down to that's like an element of sponsorship in a way. It's like being asked to participate in something that's going to advance your career, and knowing that somebody else is not getting those opportunities, finding a way to share that or whatever. I think that those are important ways to help. Go ahead.
Oh,
Yeah, I agree with you. I think that we have a lot of advantages at UCSF that I think aren't other places. I would like to, I think, Ben and other leaders I think are good at giving opportunities to women. And I think that, exactly, like, not only having people in the room, but inviting them to sit at the table, I think is really important. And I thank Ben for some of the opportunities that he's given to a lot of the women in our department. And I think that leading by example is really important. And I think, just being cognizant of like what teams you're on and who you can bring in. And, if you feel like the groups that you're in are not diverse enough, like soliciting opinions from other people and, inviting people in, I think is really powerful too. I think sometimes people may not know that they're welcome in certain spaces. And I think also, outreaching to others can be really powerful as well.
Yeah, I would say you should come to the Department of Surgery with that attitude, and you too, man. I would say that also women should be encouraged to do that, because so often we're each other's worst critics and we're like, well, I got here, get here on your own. The people who've invited me to join surgical societies, who've sponsored me, who've given me a lot of my opportunities, were actually the men in my department. Also, in the OR, Dr. Asher, who's so revered here, everyone talks crap about what a big bee she is all the time. And what's interesting is that she gets her instruments. Her cases are like this. Everyone is on their toes in her OR. And I know, as the nice person, often I get to train new people. That's what I get. And so I had an interesting case in the OR. And so I guess what I'm saying is, if you guys see that kind of stuff, maybe consider it's happening, even in this amazing place, which actually I do think is amazing. But consider that maybe it's happening and you're just not seeing it. It's like wallpaper. It's so common, I had an instance where I was doing a robotic case, and there was a man doing a robotic case in the room next to me. And I needed to do some movements with the patient after we'd already docked. And I was told I didn't have the robotic bed. And I was like, that's really weird. It's always in this room. And so I called in the person who makes those decisions. And I said, where's the robotic bed? And she said, well, I gave it to the guy next door because he's doing a really hard case and I really wanted it to go well for him. And so I took her aside into the substerile and I just said, you're a woman, you throw down sister language all the time. And I just want you to say, like, I see you and you're part of the problem, man. Like, you give us nice women surgeons, the nice ones, the crappiest help, the shittiest instrument set, the table that doesn't work. Like, just think about it, not hating on you, but just think about it. And now, oh my gosh, that woman has changed so much. So I think us trying to consider, like, it is happening, just it is. So maybe we can open the lens a little wider and try to see it. And then, if possible, call it out with humor or collegiality. I didn't yell at that woman. I just said, look at the facts, girl, and we came to an understanding. So.
All right. Okay. So we're at the hour, but it sounds like the kind of major themes, allyship and mentorship. So that's all something we can continue to work on. Thanks everyone for watching. Thank you, Sarah, for being here, and have a great day.